Welcome to an overview of child abuse prevention initiatives in California. This video is designed for partners involved in prevention work, offering insights into the progress made in California's efforts thus far. This video will cover the definitions of prevention, the frameworks implemented across California counties, an overview of prevention funding, and initiatives such as the Community Pathway and mandated reporting to community supporting. An overview of prevention. What is child abuse prevention? Child abuse prevention is reducing factors that contribute to child abuse through supports and services. In California, county prevention teams are implementing plans to provide prevention services to support family strength and resilience. Why is prevention important? The surroundings in which children, families, and communities live and play a vital role in their health, well-being, and overall quality of life. Promoting the happiness and welfare of children and families is essential in the battle against child abuse and neglect. What is child and family well-being? When families are healthy, safe, and economically stable, their children's health and well-being can thrive. This includes physical health, emotional health, mental health, financial stability, social well-being, satisfaction with life, and activities and work. Primary prevention is programs and services directed at the general population to strengthen communities and improve child well-being. Secondary prevention are strategies that are used to support children and families when a need arises. Tertiary prevention are interventions and services when maltreatment has occurred. Prevention frameworks. Protective factors refer to the qualities or strengths of individuals, families, communities, or societies that help reduce risks and encourage positive well-being and healthy growth. When families display proficiency in these areas, the risk of child abuse and neglect diminishes, paving the way for a nurturing environment that supports optimal child development. Social determinants of health are the conditions in which people are born, grow, live, work, play, worship, and age, and they significantly impact health, functioning, and quality of life. These factors, including economic stability, education, healthcare access, and social environment, can either promote or hinder well-being. There are many primary prevention strategies that can address and support social determinants of health. For example, Head Start programs increase education access for many families. And for social and community context, there are several venues that offer that relational and social support, like faith-based organizations or family resource centers. Investing in primary prevention is a great way to increase people's overall well-being. Child abuse prevention has a long history in California. Next, we will go over the background before diving into recent efforts. California has been an innovator in the child abuse prevention space for decades. The first county child abuse prevention councils were founded over 50 years ago in the 70s. Those led to statewide efforts, such as the 1989 passing of the Child Abuse Prevention Coordinating Council Act. Today, CAPCs exist in almost every county to act as coordinators, conveners, and catalysts of child abuse prevention. For more information, check out the Welfare and Institute codes listed below. Collaborative prevention planning history in California. The contemporary collaborative prevention efforts began in 2017. The County Welfare Directors Association created a challenge to broaden their focus to embrace prevention. The Child and Family Enrichment Cabinet formed the following year, which was a partnership between county child welfare directors, the Office of Child Abuse Prevention, the Child Abuse Prevention Center, and Strategies Technical Assistance. In 2019, the first State Prevention Summit was held in San Diego. 22 counties attended, and teams were co-led by child welfare and child abuse prevention councils. Teams created action plans, and then a second convening was held later that year to report back on the plans. Since 2019, Strategies Technical Assistance and the Office of Child Abuse Prevention have continued to collaborate to support counties with strengthening local prevention planning. In 2021, the next convening was held, and in 2022 the convening continued, this time with a focus on bridging the prior prevention work with family-first prevention services and comprehensive prevention planning. timeline of statewide prevention convenings. To date, there have been 7 statewide prevention collaborative convenings, each with their own focus as counties move from planning to implementation of Family First prevention services. The next convening is scheduled for March 2026. California's commitment to prevention. The Family First Prevention Services Act was established federally in 2018. Since then, California has deepened its commitment to child abuse prevention and taken multiple steps to align with the federal vision for prevention. California submitted its 5-year prevention plan in 2023. This plan envisions an integrated statewide system that supports families to provide safe, stable, nurturing relationships and environments for their children and youth. Working together to implement the Family First Prevention Services program. In addition to creating its own prevention plan, California offered counties and Title IV tribes the opportunity to opt into Family First Prevention Services to access funding for child abuse prevention. In order to receive funding, counties and tribes were required to create a comprehensive prevention plan. While plans were originally due in January 2023, California has since recognized that this deadline created a hardship for small counties and tribes to access the funds. In an additional all-county letter, California offered flexibility to small counties and tribes around EBPs as well as extended the deadline for them to submit a CPP to December 1, 2025. Overview of funding. Counties and tribes opting in to Family First Prevention Services have several funding streams available to them. Federally, they will be able to access Family First Prevention Service Act funding for evidence-based practices. This funding is focused on secondary and tertiary prevention. Counties and tribes also have access to the state FFPS block grant, which can be used for primary prevention. This funding is set to expire on June 30, 2028. Existing prevention dollars may also be used for these efforts. These include community-based child abuse prevention intervention, and treatment and promoting safe and stable families. Counties were also able to access American Rescue Plan Act community-based child abuse prevention and Family First Transition Act funds to support prevention planning and implementation, but those funds expired in 2025. What is a comprehensive prevention plan? In order to access the Family First Prevention Services funds, counties and tribes were required to submit a comprehensive prevention plan. This is a written plan that's designed to create a system where families can get the help they need wherever they go, and it emphasizes collaboration between family-strengthening organizations and county or tribal agencies. Components of a comprehensive prevention plan. While CPPs have many components, 2 of the biggest components in terms of accessing funding were identifying candidacy and evidence-based practices. Counties were able to select from 12 candidate groups and 10 EBPs. Candidacy groups determine who is eligible for FFPSA-funded prevention services, and the evidence-based practices are what those services are. You can see the full list of candidacy groups and evidence-based practices that were available to counties in the state's 5-year prevention plan. Where is the work now? Since Family First Prevention Services Act was enacted federally, 52 counties and 3 tribes have submitted and approved comprehensive prevention plans, and 3 more counties planning to submit by the small county deadline. Now, counties and tribes are moving toward implementation, especially of the community pathway, which we will provide more details on later in this presentation. Counties are also continuing to engage stakeholders to ensure community voice is present in the development of their prevention services. Where is it going? As implementation continues, the California Department of Social Services is continuing to create guidance and resources for counties and tribes. Some guidance has already been released, like the Community Pathway Framework and Evidence-Based Practices Briefs. One of the top focuses of 2026 is the rollout of CWS Cares, which is California's new child welfare information system. It will be used to identify eligibility for reimbursement. Once EBP providers have joined it, they'll be able to submit for 50% reimbursement for evidence-based practices under FFPSA. Now we'll speak about the shift from mandated reporting to community supporting throughout the state. shifting from reporting families to supporting families. In California, the vision is for child, family, and community well-being, and that it is centered on equity and social justice and respect for tribal sovereignty. To make this vision a reality, reform of current practices and policies regarding mandated reporting and responses to child abuse and neglect allegations is required. To provide context on why this is important, in California, general neglect is the #1 allegation based on mandated reporting data. Mandated reporting to community supporting reform. In September 2024, the Child Welfare Council approved the Mandated Reporting to Community Supporting Task Force report. The goals are to 1. Reform the state's mandated reporting system and 2. Build strong and connected community supports. The North Star is to keep children and families together, safe, well, and strengthened by the resources they need to thrive. The recommendations are in the areas of data/accountability, policy, training, community pathway, and narrative shift. The Mandated Reporting Advisory Committee was established for the implementation of these recommendations. To learn more, please review the MRCS Task Force report and recommendations. Next, we will talk about community pathways. What is community pathway? The community pathway is an avenue in which children, youth, and families can receive early intervention services at the earliest point possible to minimize the stigma of working directly with the child welfare agency. Families can self-refer, or be referred by a public or private entity such as a school, healthcare provider, or local organization. California's vision for a community pathway is to support families via No Wrong Door by creating conditions that allow for all families to thrive in safe, stable, nurturing relationships and environments, while actively working towards eliminating racial and ethnic disparities and other forms of inequities. Community pathways values are family voice-centeredness, racial equity, tribal consultation and collaboration, strength-focused and trauma-informed, community capacity building, workforce excellence, integration and collaboration, monitoring, integrity, and continuous quality improvement (CQI). This vision can only be achieved through a collective commitment from a wide range of community and governmental partners, while centering the voices of the community and those with lived expertise across all levels and activities. Community Pathways Framework. This graphic comes from the Family First Prevention Services Program Community Pathway Framework brief by the Child and Family Policy Institute of California. This framework provides 6 steps for implementing community pathways throughout California. The steps include 1. Create a sustainable foundation for implementing community pathways. 2. Develop cross-sector partnership agreements. 3. Establish internal procedures. 4. Identify services and deliver with equitable access. 5. Collect and report outcomes. 6. Conduct ongoing continuous quality improvement (CQI) analysis. For more information, please review the Community Pathways Framework brief. Here is a simple scenario example of community pathways. In this scenario, a family comes into a community-based organization looking for help. There are various pathways the family can access based on the level of supports they may need. Now what's next? Take a moment to reflect on these questions. 1. Are you connected to your county's prevention efforts? 2. What are some ways your collaborative team supports children and families? 3. What supports and/or resources do families need to be healthy and thriving? 4. What can you contribute to support families thrive? Have you heard of CalPrevents? CalPrevents is an online community for professionals that are actively engaged in local efforts to implement and maintain innovative prevention strategies in the state of California. With CalPrevents, prevention professionals will be able to connect and peer share with others, access and share resources or events, and ask questions. Do you want to learn more? Check out a few statewide prevention partners: the California Department of Social Services, California Training Institute, Child and Family Policy Institute of California, and Strategies Technical Assistance. Thank you for watching.